Since the Ebola outbreak began in West Africa over a year ago, Sierra Leone has recorded more than 10,000 cases, making it the worst-hit country. But signs are growing that the tide is turning against the disease. Quarantine measures which were in place in 6 of 14 districts have now been lifted. President Ernest Koroma, who aims to get to 0 cases by the end of March, said restrictions on trading hours in the capital Freetown would also be eased.
There will no longer be any district or chiefdom level restrictions on movements. No quarantines or restrictions on movement above the household level will be imposed either by government or local authorities.
However, individual households with known Ebola contacts will remain under quarantine. Koroma said the country cannot relent.
The fight will not be over until we have had 0 cases for 42 days. Until our neighbors in Liberia and Guinea have had 0 cases for 42 days. Until our surveillance capacity can ensure that no new cases are going beneath the radar, and until we have built the capacity and resilience in our healthcare system to interrupt transmission and prevent future outbreaks.
The deadly virus has left a trail of devastation in its wake. Many are trying to rebuild their lives after losing their loved ones.
There is no one left in the house. It's really frightening. I had a strong relationship with my children and my husband. I was always hugged as soon as I got home.
Others have found that joining the fight against Ebola helps the healing process.
Why I survived?
After I survived Ebola, I really tried to help the community whenever someone was found to be sick. I had to move the person from the house to the medical center so that they can have better treatment in order to save their lives, just like me, and also to stop the disease from spreading further in the community.
Let it not spread.
In the latest health report, Sierra Leone reported just 9 new confirmed cases versus the 60 recorded daily late last year. But challenges remain, with no central database of Ebola contacts and health workers struggling to locate suspected cases in difficult-to-reach areas. President Koroma now wants to decentralize the Ebola response to handle isolated rural cases, which it's hoped will get help where it's needed faster. Clementine, Logan, CCTV.